Wow.
Oh, hey Ash, why are you back so early?
I don't know, I was just at the gym and every time I'm doing my sets, I have to take breaks frequently. I'm getting tired, dizzy, I'm starting to get headaches.
Again?
Yeah, again.
I think we should go to the doctor this time.
Yeah, I think we should.
Take a shower and get
So, what seems to be the problem?
Well, I've been going to the gym lately and I can't do the same routine I've been doing for the past few weeks. I don't know what's wrong because I really haven't changed my lifestyle.
How long has this been happening for?
About a few months or so.
Why haven't you come earlier?
Oh, you know, man.
Alright, well look, I'm going to check your blood pressure.
Alright.
Oh wow, your blood pressure is 175 over 110. Look, that's pretty high. You've got to start making some lifestyle changes. You know, change your diet, continue with physical activity. But there are some drugs I can prescribe for you just to help lower the blood pressure because it is so high at the moment.
What are these drugs and how do they work?
They're called ACE inhibitors, angiotensin converting enzyme inhibitors. I can show you a short video if you like.
Yes, please. I'd
Tells
like
you
to know
about it.
what my husband is taking.
Yeah.
ACE inhibitors such as captopril and enalapril were first introduced in the 1980s. They were the first class and most widely prescribed drugs to act against high blood pressure by dilating the blood vessels, thus decreasing it. The main functions of ACE inhibitors include inhibiting the conversion of angiotensin 1 into angiotensin 2 and inhibiting the degradation of bradykinins into inactive peptides. Firstly, let me talk to you about renin-angiotensin-aldosterone system. When kidneys detect a drop in blood pressure, they release an enzyme called renin. Renin comes in contact with inactive precursor made by your liver called angiotensinogen, which is converted into angiotensin 2 by losing 2 amino acids. Angiotensin 2 is then released into your blood vessels, thus causing vasoconstriction and increasing blood pressure. Moreover, aldosterone is also then released from the adrenal cortex. It causes reabsorption of sodium and water and excretion of potassium, leading to the decrease of urine to raise blood pressure. ACE inhibitors work by feeding into the active site of ACE and are not cleavable. This is why they are irreversibly competitive. Therefore, angiotensin 1 cannot be converted into angiotensin 2 and blood pressure will not be raised. Another way in which ACE works is through the degradation of bradykinin, active peptide. Bradykinin is a peptide that stimulates nitric oxide, leading to blood vessel dilating. However, ACE inhibitors prevent the degradation of bradykinin and therefore it accumulates in the body, leading to further lowering of the blood pressure. It also increases permeability of capillaries in the kidneys to increase the excretion of sodium. This also contributes to lowering of blood pressure, and ACE inhibitors can interact with other drugs. Non-steroidal inflammatory drugs such as ibuprofen reduce the effectiveness of ACE inhibitors, as bradykinin releases vasodilating prostaglandins, and this is enhanced by ACE inhibitors. In more complicated cases, ACE inhibitors can be given with other drugs, such as angiotensin receptor blockers and diuretics, as they don't give side effects and, in fact, promote positive effects of ACE.
Well, that sounds like it would help me.
Are you sure about this, doctor?
Yes, absolutely. I mean, these drugs are even used to treat people with diabetes, heart failure, heart attacks, coronary artery disease, kidney diseases, and even sometimes people with migraines.
Sounds good to me.
Wait, it can't be that perfect. Are there any side effects?
Well, look, ACE inhibitors don't usually cause major side effects. However, they do have some. Initial use of these drugs can cause your blood pressure to drop significantly, which can cause hypertension, which is low blood pressure. They can also lead to a dry cough just due to bradykinin accumulation, which is normally decreased by the ACE inhibitors. It can also cause fatigue, dizziness, sometimes even fainting. Another side effect is it can cause your blood potassium levels to be increased, which can cause hyperkalemia because of reduced aldosterone secretion. One last thing, don't use them during pregnancy or if you're pregnant because it can cause birth defects or fetal toxicity, but Ash, you don't have to worry about that obviously.
Well, I guess the positives outweigh the side effects, so yeah, I'll take the drugs, doctor.
Alright, great, I'll write you up a prescription and I'll send you home with a follow-up monitor program just to keep an eye on you. There you go.
Alright, well, thanks, doctor.
It was great to see you.
Thank you.
And you come in for a checkup next.
Yeah, sure.